this way. So let's go this way first. So it's this side of the unit, right? Yes. So I want you to observe the lateral rotation restricted about 30 degrees. He's very guarded, broken patterns of movement, and the infill is classical textbook. This is about it. This is about the most advanced stage capsular pattern you will observe and see in your treatment process. Okay, so when I come like this, I want you to turn your back this way for a second. I want you to observe the scapular function when he raises his arm. Here's the scapula, and all of that abduction is scapulohumeral abduction. That scapula shouldn't upward rotate until about 45 degrees of abduction. So if I keep that scapula down and I go here, there's a hard infill. There's no way I can separate the humeral head from the scapula because that is adhesive. That bone is glued to that bone because they have to move as one. Can everybody see that? Can you actually observe that humeral scapular fixation in that joint? Okay, so let's go on the table. Having had hip replacement, I would do counterstrain work because there is post-surgical scar tissue, and it was your left side. They're going to get some arm rests, so we'll get those arms supported in a second. One of the very first things I do, I was reading a research study online, and they would inject the shoulder to numb the nerves, to break the holding pattern of the nerve pathways. What I'm going to basically do, and this is the shoulder that's most involved, this is going to be cold, but by applying the CryoDerm to the area, I'm calming the pain receptors. I'm blocking the gatekeeper of pain. In adhesive capsulitis, the patient will always splint that shoulder. It's a protective mechanism. We have to break that pain spasm cycle. We have to calm down the pain receptors. We cannot override the guarding responses of people with capsular patterns of shoulder. So I'm letting that work itself into the tissue. And then we're going to show you an assessment here. When I go to lateral rotation to see how guarded he is, somebody has tried to pull on that arm without releasing that capsule. So when I relax him a little bit, he's got a little bit of motion, but he can move just to that point. But if I get to that point and there's that hard or bone-on-bone-like infill, you cannot stretch or manipulate that joint. So let's come around that way with your camera because I'm going to be blocking your view. So I'm going to just let the arm relax. Now this is the counterstrain. So we've calmed down the pain receptors with the CryoDerm. Now we're counterstraining the shoulder. So now we're relaxing everything of that capsule. Everything that's in that shoulder is in a place of counterstrain. By Jones' research on counterstrain, this must be held for 30 to 90 seconds. It takes the proprioception of the brain and the calming down of the pain receptors and the breaking of the holding pattern of the shoulder, 30 to 90 seconds to allow, now I can already feel him relaxing that shoulder. And then I just do a little capsular stretch. And then I do a little counterstrain, and then I do a little capsular stretch, and then a counterstrain and a capsular stretch. Now he's going to be very guarded because he's used to somebody pulling on that capsule, but I want you to know that your arm can fall out further. Let it relax. I want you to know if you relax those muscles that we can go to that new end range, and we can go to that new end feel, and then we can go back to our counterstrain at that new hard end feel. Everybody with me so far? I'm holding back into counterstrain for another 30 seconds. This is the hardest part, is to learn the patience to allow the proprioception of the pain to relax and allow the guarded and splinting pattern to release. And I'm feeling when I do the CryoDerm ahead of the treatment, I'm feeling that the pain receptors are calmer, that I'm breaking that pain spasm cycle sooner and faster, and then I'll get in and I'll release that. And now you will have full range of motion on lateral rotation, but you have to trust me that I'm not going to move it. You have to let it move and let it fall out with full range of motion. So that's the starting part. Now, Vladimir Younger, a brilliant osteopath, said pec minor is the most problematic muscle. So can we get the CryoDerm, the red bottle right there, right? Because there's too much resistance from the CryoDerm pain reliever, now I'm going to apply the CryoDerm Myofascial cream or lotion, and then that gives me, it still doesn't give me glide. I'm not going to slip. It gives me resistance. And what I'm doing now is through resistance, I can engage deeper myofascial changes into the connective tissue, and through the resistance that is coming from the application of the CryoDerm, I'm able to stretch that pec minor more effectively and roll that shoulder back. Now there's going to be a speed bump here. When I go to stretch pec minor, there's going to be a secondary capsular pattern. This is experiential. I've done thousands of these shoulders. So when I come back here, you can see he's very guarded. You can see him, he doesn't want me to let your shoulder relax. And the reason he's guarded is there's a hard infill right there. And if I stretch it, he's not going to like it. So what I'm going to do at that hard infill is I'm going to go right back. Let me have the arm. I'm going to relax the capsular pattern. This is known as Counterstrain, another 30 seconds. And then I'm just going to stretch that capsule. I felt it release before 30 seconds, so my experience moves on, right? And now what I want you to feel is, I want you to feel that that humerus is completely free of that scapula. Do you feel that? I want him to be consciously aware the nervous system controls the fascial system. He'll split me if I don't tell him what he's going to feel. The nervous system controls the fascial system. So now what I want you to see, if he begins to trust me, is that we can now stretch out the pectoralis minor to get rid of shoulder impingement. Due to the capsular technique, we can now stretch out the pectoralis minor to get rid of impingement. And then Vladimir Yonda said that the upper traps and the middle deltoid, we know from our classroom, is that the upper traps and the middle deltoid elevates the humeral head. So we get that humeral scapular fixation. If I want to release the upper traps and middle deltoid, what I'm going to do for just a second is I'm going to have this young man, and I know your hip and knees hurt, but I'm going to pull these off in a second. I'm going to have you roll. I want that shoulder up. So you're going to roll onto your side. I'm going to make a space for your shoulder. So let me move these cushions just a bit and put this shoulder right in there. And I just want that relaxed. Now, this is critical. Bursitis, supraspinatus impingement, adhesive capsular patterns are from the contact and the adhesion of the humeral head into the acromion. So if I get into those upper traps, and again, I'm going to just put one more drop of this on. I hate when people put on lubricants that create glide. You can't hook fascia. So with the CryoDerm, I'm just creating resistance to glide. I'm hooking that fascia and engaging those traps. Now, I don't want to press on the acromion. I don't want to press on the acromion because it'll press on the adhesive pattern and the bursa and the supraspinatus, which is injured. We know the supraspinatus is injured. Now, once I get that released, what is going on is that the humeral head is fixated into the acromion. So now when he relaxes that shoulder, if I elevate the humerus, now this is the acromion, you know your anatomy, this is the middle deltoid, and right under there is the, go ahead and relax your arm for me, is the adhesion in the capsule. And if he doesn't relax the arm, I can't, there, it's just released. Do you feel that dropping down? Now I have freedom between the acromion and the humeral head, and there you can feel that capsule moving all over the place. Now I will easily be able to stretch his subscap. See the movement that's available to this young man? Everybody's a young man. We're both approaching middle age. That's really good. We're young men.
I'm only 69.
He's only 69. That's a piece of cake. I've been doing this on 88-year-old people, so he's a young man compared to some of these clients that have had this for 30 years. The direction of my myofascial therapy is to relax the rhomboids, relax the infraspinatus, relax the teres minor, relax the muscles in the back of the shoulder, and then stimulate the spindle cells. So I'm waking up these muscles. They need to stabilize that scapula. Otherwise, the scapula, if you put it under a light stretch and then do spindle cell work and approximate the muscle, it wakes up the neurological system in the back of the shoulder. And now we're almost done. We're just going to slowly go face up. I don't spend more than 10 minutes on complicated shoulder patterns. Now, what I want to do is just know that you know that you can trust me, all right? So I'm not going to move your shoulder where it hurts. So what I want him to know is that when you relax that shoulder, we can stretch out that pec minor and see the muscle firing of the face changes. Knees fire, knees stretch out. That's really cool, right? So I try to bring a little humor. When you've been in pain, it's hard to laugh, right? So I try to bring a little there. That's just released. You feel the movement. It's completely free. And so now if I just go here and I relax your shoulder and I just get into that humeral head, you feel how that's completely free. So now you know that you can trust me and you know that you can bring that all the way to your ear, right? You know that you can do that. And now what I want to do, if you can give me that CryoDerm spray, you have changed a lot of stuff. Before I work on the injury of the supraspinatus, I'm going to calm down the pain receptors again. This is a valuable tool in my toolbox to allow me to do more effective therapy to break the pain-spasm cycle so that I can get into that supraspinatus and loosen up that muscle belly. Now I get into that supraspinatus and loosen up that under the traps. And now what I'm going to do is I'm going to take this little wedge and I'm going to put it in the armpit, and I'm going to let your arm pivot around that wedge so that I can pull the injured fibers of the supraspinatus out here where I can treat that. So now I'm pulling the injured fibers that were under the acromion. I'm using a pivot to traction the humerus out, to pull those injured fibers of that supraspinatus, and it's tender right there, right? So now I'm treating the injured supraspinatus that tested positive. And frictioning does not realign scar tissue. It's written in books, but it's not. Frictioning softens the scar tissue matrix. It lays down a little collagen. It doesn't realign it. The only thing that realigns scar tissue is an eccentric muscle contraction. So I'm going to stabilize your scapula, and when I bring your elbow in, just barely resist me. Let it move. The eccentric force that is done pain-free will prevent them from having rotator cuff surgery because it realigns the scar tissue. And now, when you push your elbow out towards me, you still have pain in that supraspinatus. Now, see a smile? And now stand up. That was about a 10-minute treatment. And now what I want you to do, and it works every time, 30 and 40 years of frozen shoulders, it works every time. And so that was which shoulder? Left. So let's do this. Now, do you see how anxious he is? Let's turn this way just a little bit. Now, if we stretch your subscap, and know that we can, trust that I won't force it. Now you have full range of motion of lateral rotation. If we stretch your pec minor, trust that we can, I won't force it. Now we can roll it back and stretch pec minor. If we stretch your upper trapezius and just relax those muscles and drop that humeral head down from that acromion to get rid of bursitis and supraspinatus impingement and pain on that injured supraspinatus, now watch his new degree of full and complete abduction in the shoulder. And see how happy he is. That's why I do what I do 45 weekends a year around the world. To see that look on my patient's face is invaluable feedback for this industry. Thank you guys. We'll go back to the classroom. Appreciate it. And then I want to throw on some, I want to spray him. Can one of you guys spray him down with a little CryoDerm just to get that finished off, get that calmed down? Thanks, guys. You're welcome. It was great. Thanks for the opportunity to do that.
Wonderful.
I appreciate it. Thank you. Can you give him a little testimony at the end? Do you mind?
I took this class not knowing what to expect, and I'm just impressed. I need to learn this work.
You're a chiropractor?
Yes, I am.
And you would recommend that other chiropractors take this course?
Absolutely, yeah.
And tell me about your arm, what it did for you.
Well, I had that particular shoulder. I've not been able to raise past about 90 degrees for quite a few years.
Okay.
Just injuries from sports and weight training and all that sort of stuff.
Right.
And so I've actually become in worse shape than ever before because I haven't been able to do the kind of exercises I used to do.
And now after the treatment, tell me about your shoulder.
I got full range of motion. I haven't had that in years.
Great. How's the CryoDerm feel on your shoulder
It's
too?
good.
Good.
Feels good. It's not uncomfortable.
Great. Thank you. We're glad we could help.
Thank you.